How many successful MSCs have you seen, and how many MSCs that had a problem in the end?
Good question, bro. MSE is a shit show, and I cannot dance around that fact. Bad MSE cases are drawn to my channel and to me like moths are drawn to the light. I'm like Yelp for bad MSE cases. In terms of good MSE cases, I've seen a lot of those too. The MSE user group is full of good MSE cases. Even though it seems like there's more bad MSE cases than there are good ones, think of it like this. In the early days of airplanes, it was all fucking crashes, right? The first probably 50 airplanes that were ever invented fucking crashed and burned, right? That's kind of where we're at with MSE. We have really good airplanes, but a lot of them are still shit, and a lot of people are still flying them like shit. But the things that cause bad MSE cases, we're figuring it out quickly. More and more dentists are starting to rack up cases and learn from their mistakes. We're exiting that early period of bias toward bad cases, and I think we're going to hit a stride soon of decent MSE cases. But being dead ass with you, though, there's a lot of fucking bad MSE cases. And if you don't have the right provider, fucking good luck, man. Because I'd say there's a 50-50 shot it's going to go sideways. Stefanos, thank you for joining me on a chat today. How are you doing? How can I help you? Tell us a little bit about yourself to get us started. Where are you calling from? What's your age?
Yeah, thank you, Ron, for having me. I'm calling from Greece, Athens. I'm 24 years old now. And yeah, that's me.
Good. You look a little older than 24, man. Maybe it's the strong facial hair.
Yeah, the facial hair makes me look older. Also, the hairline makes me a bit older as well.
How do you mean?
Because it is a bit, recessing. It makes my face look a bit older, I think.
Perhaps.
So I wanted to do this call because I was watching your videos for the past 2 months, not from before. That you had a break, I think, in YouTube, and then you started re-uploading.
Correct.
Yeah. And I was seeing things that were very interesting to me. Specifically because I have some problems, breathing problems and other facial structure problems, and so I wanted to have a talk with you.
Of course, absolutely. Yeah, let me know exactly what you want to accomplish with this call and how I can help you.
Mm-hmm. Okay, so what I have seen on my face is that my maxilla is a bit short, a bit
Narrow. Okay.
Yeah,
Okay.
and that makes that has some problems, but the most important it is that it is on the inside. It is recessed.
Backwards.
Yeah,
Okay.
exactly.
Okay.
And that I think also brings the mandible inside for them to properly close, and that has some problems with how it sits. It sits a bit on the inside, I think, and it makes the air passage narrower. Now, also, I did have problems with breathing since I was a kid. I felt like my nose wasn't getting enough air. That is probably because of the maxilla, I think.
What about now?
So,
what's your breathing like now?
for the past year and a half, I'm using a nasal spray, and that has helped a lot with me breathing properly. Still, I have a big problem while playing sports. Not a lot of air comes through my nose because I am a nose breather. I was never sleeping with my mouth open, but I was always feeling tired, and it was very hard for me to wake up. It still is very hard to wake up. I feel like I'm not getting the sleep that I need. So my breathing now is not good. If I wasn't using the nasal spray, I would have a big problem while sleeping.
So the nasal spray
up.
opens your nose.
Exactly.
You feel like if your nose was more open, that would help with your breathing.
Yeah, exactly. Yeah.
Because my point is, with breathing problems, it doesn't just happen in one place. For different people, their block is in a different place. Okay, and sometimes it's the nose, sometimes it's the throat. But it sounds like for you've identified that the nose is the weak link.
But I have identified it as having two problems. One is the nose not having enough space for the air to come, and the second one is the recession of the mandible, creating a smaller passage through the throat. So it's a double problem.
Of course, it usually is. It usually is.
Yeah. Yeah.
So what are your thoughts? So where are you at with this?
For the past 5 months, before I was in this community of yours, and before I had started searching some stuff, I thought that by fixing my smile, some stuff would get better. I thought that so for the past 5 months I've used Invisalign. My idea was that by trying to open the front teeth a bit, to tilt them
tip them out
like that.
Tip them out. Yeah.
It would leave my mandible to expand forward and maybe create that.
And what have you found?
That it's not really possible to...
Who designed your Invisalign? Did you design it? Or do you work with a dentist?
With an orthodontic.
And you told the doctor that you wanted him to expand you a little bit and tip your front teeth, give you some space up front so your mandible could come forward, open your airway? Yeah. Okay. Now continue. What have you found from that?
Not much. Not much have changed. The front teeth have tipped a bit on the outside, but not even close to the degree that I think is needed to resolve the problem with the throat. Yeah,
and you probably don't want to. You don't want to tip those front teeth anymore either. That's never a good thing to do.
And so I started looking for some MSE or other options like that.
Okay.
And so I would like you to... I do have some questions here that maybe we can go through them sometime.
Yeah, why don't you just fire off... do you want to go right into the questions, or did you want me to make some other kind of comment?
I would like you to assess the situation that you see in my mouth, maybe.
Okay. Why don't you give me a big smile?
Okay.
Man, the resolution is not great for me. Is there a way that do you have any photos that you have of yourself?
Yeah, I do. I do have photos.
Okay, why don't you send me the photos, and then I'll look at them and I'll put them in the video.
Okay.
Take your time with it. I can edit out any pause. Send it to me by email.
Okay. How old are you, Ron?
I'm 32.
Oh, you don't seem like 32.
What do I seem?
27.
27? Thank you, man.
Yeah.
Yeah. No, 32, man. I'm getting old.
Okay.
Yeah, you know, I wish I could give, you 5 of my years and cuz you look 27, and
Yeah.
I look, maybe you say I look 27. So we meet in the middle.
Yeah, yeah. But I'm okay. I'm okay by being 24.
Yeah, no, you're better off, man. God, if I could be 24 again, shit, the things I would do.
Yeah. What are you working with now? What do you do?
Besides YouTube,
Yeah.
I run a tax prep business. So, you know how you have to pay taxes?
Mm-hmm. Yeah.
So in America, every year you have to file a tax return.
Yeah, yeah.
Same there,
Mm-hmm.
maybe. And so
Yeah,
I
yeah.
help people prepare their taxes to get money back or to pay money to the government, like if they run a business.
Yeah, yeah, yeah. Okay. We
Yeah, it's
also
my
have it here.
mhm
Yeah.
mhm it's my father's business,
Mm-hmm.
but I took it over a couple of years ago. So we work together, but I kind of run it.
Okay.
Yeah, so we have clients, they come in and they come right to our home, which is where our office is, and um, they meet with us, and then we help them prepare their taxes.
Mm-hmm.
Yeah, I like it because it's very people interfacing. I get to meet a lot
Yeah.
of people. I get to um, practice my social skills. I get to have uncomfortable conversations, telling people that they owe the government money, or tell people that I can't do what they want me to do, or another very difficult thing that I've had to learn is asking people to pay me for my services. It's
Yeah.
it's one thing when you pay me online through a credit card, I don't have to ask you for the money, but when you have in-person clients, you have to say, "Oh, here, and the bill is $500 or whatever." And then
Yeah,
it
it's
can be
different. Yeah.
awkward. Yeah. So, yeah,
Yeah,
I like it because it's such a people interfacing job, and it helps me sharpen my social skills.
yeah. Mm-hmm. Yeah.
Yeah, and it
No, it
pays
seems
decent. It's not
interesting.
bad.
Yeah,
Yeah,
yeah.
I like being
Yeah.
self-employed too.
It's very important, I think,
Yeah.
nowadays.
Yeah, yeah. So what's going on with these photos?
I did send them to you on your email.
Okay, let's take a look at these pictures that you sent. I'm going to do a screen share,
Mm-hmm.
and we'll go from there.
Yeah.
Yeah, so immediately I'm seeing narrow buccal corridors, narrow maxilla, large buccal corridors. The buccal corridors are the areas near your between your teeth and your lips, right? So when you see black here, that means it's narrow.
Mm-hmm.
The smile should fill this whole space. Okay? Nice
Yep.
teeth. They're straight, they're white. They look good. Yeah, narrow. Not the most narrow, but definitely somewhat narrow. 1, 2, 3, 4, 5, 6, 7, 8. Do you have all of your teeth?
I haven't gotten a tooth out, a tooth extraction, but yeah,
That's amazing, man. That's very rare. Even your wisdom teeth you have.
yeah,
I'm jealous. Wow, look at all those teeth, bro. You're fucking killing it with all those teeth.
there are many, but they are not in a good condition because of the grinding.
Fair enough. Yeah, we got to get you some more space. So your maxilla is not the narrowest I've ever seen. It's moderate, I would say, from this
Mm-hmm.
angle.
Yeah,
It's somewhat high and vaulted, but it's definitely not like, oh my god, that's the narrowest maxilla I've ever seen. It's quite decent actually. Um,
yeah,
it surprises me that you have the breathing troubles that you do with a maxilla like that. It's solid.
yeah,
But from this angle, it does look narrow. If you were gonna do like an MSE, it would be nothing crazy, man. Like I'm talking, 5 millimeters just to pop open that nose, get it breathing better. But we don't have to go crazy here with expansion for you.
yeah. I agree, and it's something that I was thinking that I saw you saying that a moderate expansion is the best option, and for my problem, I think a moderate expansion is the only thing that you need to do.
Yeah, one other observation I'll make. You see how these teeth are tipped out? They're tipped toward your cheeks,
Yeah,
some of these molars.
yeah,
It would be better if they were tipped upright or even in a little bit. So, you could get a significant amount of expansion and then just take of the bone with the MSE and then take these teeth and tip them into a healthier position. See, these teeth are okay. They're more upright, the premolars.
yeah.
But when you get to the molars, they're flaring. They
Probably
seem flared out.
Invisalign.
The Invisalign is doing that?
I think that it is that probably.
Right. Probably that's part of the expansion protocol that this dentist is doing. He's probably trying to give you tongue space by tipping your teeth. Yeah, see, this is why I don't like tooth-borne expansion as a primary means of expanding. Because, it's periodontally compromising. The teeth aren't supposed to be tipped out like that. Yes, it's something you can do to increase oral volume, but the better way to get that expansion is to split the bone and then to keep these teeth upright. So if you go down the path of doing an MSE, those teeth are going to come right back to where they were before, and you're just going to expand the bone instead.
Mm-hmm.
Yeah, these back to the second and third molars especially are flared out. All of the molars are flared out.
Yeah.
And there looks like some irritation on the gums here, man. Maybe the Invisalign is pushing these teeth out. I would pump the brakes on that right away.
That's what I want to do. Yeah.
Yeah, you don't need to be fucking with your teeth anymore like that, bro. If you've watched my stuff, I think tooth-borne expansion should be the sauce, not the meat. Right now you're using it as the meat.
Yeah, I agree.
And here you can see the molars coming out a little bit. See, that's a better angle. See how they're angled in, these other teeth? And then this molars, here it just comes upright. So, yeah, I think you could do an MSE, moderate MSE expansion.
Mm-hmm.
Let me end this share. I do. And let me look at your side profile now, bro.
Yeah.
Yeah, so it's being obscured a little bit by the facial hair, and you do have a gap in your facial hair right there on the side. What's up with that?
It's from both sides. It was from when I had acne. Two of them. How do you say it?
The skin is damaged and the hair doesn't grow there.
Exactly.
I understand. Okay, all right. Fair
you
enough.
saw the profile.
Let me see it again. You kind of look like Ashton Kutcher. Do you know who that is?
Yeah, I do.
I like the projection of the chin. It's obscured by the facial hair, bro. You might be more recessed than you look now. I think you look good. If you want me to be honest with you, I think you look good. I like your dark, facial hair and features and big eyebrows, and I like how it all comes together. I think you're a handsome guy. But take off the facial hair, and I bet you it looks a lot weaker.
A lot weaker. Yeah, 100%.
I bet. But hey, I mean, you can have a beard till the day you die. No one can take that away from you.
Sure.
That's one great looks maxing hack that any man with decent facial hair at least can do, is just fatten up that beard, and it literally adds forward growth and lateral growth to your facial appearance.
Yeah. If it wasn't for the breathing problems, I wouldn't think of doing something.
Interesting.
Yeah.
Yeah. Then
So,
in that case, I do think you're a candidate for the MSE based on your breathing problems, based on the apparent narrowness of your maxilla.
Mm-hmm.
I think you would benefit from an MSE, moderately expanded, 4 to 6 millimeters. until you can experience your nasal breathing get better. You should feel it as you expand. You don't have to wait a year to feel that. You can feel it right as your suture splits. If with every turn up to 5-6 millimeters, you should feel an improvement of your breathing.
Yeah. And also a very important part of the treatment that I want to do is the forward growth, because I think the maxilla needs to come forward for the mandible.
That's going to be tough.
I know.
It's going to be tough. There's no good way to do that. Do you have TMJ problems? Clicking?
No.
Pain?
No.
See, now it's even tougher. Because if you start tugging on that maxilla with, like, let's say a face mask.
Yeah.
So what's your lower jaw going to do? It's going to stay back. Because right now your joints are healthy.
The thing is, my resting position without the mouth being closed is this.
Right. And I saw that when you bit. When you bit, you had an open bite. Meaning you were biting like this. So that there's a space. Your back teeth aren't touching. Yeah, there it is. There it is. Yeah.
Yeah.
That's tricky, bro. That's tricky. Because really it's your maxilla's angle in addition to its front back projection that's causing you to do that. Your maxilla is clockwise rotated. And so the best way for you to fix that bite's like this now.
Mm-hmm.
You got to rotate this counterclockwise. You know, you got to take your maxilla and you got to. So right now you're like this, right?
Yeah.
So bringing the maxilla forward will help with that because, you know, your lower jaw wants to come forward a little bit, but really the bigger problem is the angle of your maxilla. If you got counterclockwise rotation, then that would bring the maxilla forward and it would flatten out that bite. Because right now your maxilla is angled down toward the earth.
Yeah.
So you got to flatten that out, but there's only one way to do that, bro, and that's with double jaw surgery. The face mask can't really do that with any amount of predictability. What were you thinking in terms of front back? How would you expand yourself forward?
Only with the face mask and try
face
to
mask.
Yeah. And get whatever I can get. If I go through an MSE, I am not losing anything.
I agree. And the good thing about face mask is fucking, you know, it's so slow. You can just monitor your progress. It's not like, oh, I'm going in for surgery, I'm going to go to sleep and wake up with a whole different face. It's like you wear it every day for a couple of months, give it 6 to 12 months, and see where you end up. You're not going to overdo it. Everyone wishes they could overdo it with face mask, but they can't. The problem with face mask isn't that it's so sudden, it's that it's so slow.
Have you seen anyone getting good results with a face mask?
I haven't seen anyone in your position getting good results with face mask. I've seen class 3 get good results with face mask. I've seen class 3 cured with face mask. What I have not seen are people like you, and you're very, very, very common. Probably the most common type of patient I talk to, someone like you, who they're not technically a class 3 like this, but when they bite comfortably, they become a class 3. Meaning when they relax their jaw, now they're biting like this.
Yeah.
Like you, a little bit. The lower jaw comes forward. Right. But ultimately, if you were to smile for a photo, you would go like this, right? You would go, and you would bite regular, right? With your front, you wouldn't bite.
Yeah.
You wouldn't. It's only when you focus and you relax that lower jaw comes forward. So you're not technically a class 3. Any dentist will say, bite with your back teeth touching, and that's your true bite. And so I've never seen
Yeah.
anyone in your position use a face mask successfully, but that does not mean that it can't be done.
Mm-hmm.
In theory, it should work fine to bring your maxilla forward a little bit and allow you to have that lower jaw forward always.
Yeah. So the only solution for that to be fixed is double jaw surgery. You said for that to come in front.
Predictably,
Forward.
yes. Predictably.
Okay.
The
Yeah.
only way that I can guarantee you it'll get fixed is with double jaw surgery. Yeah.
Okay.
And have you considered double jaw surgery at all?
No.
It's a little out there for you, man. I mean, a guy
Yeah.
like you, pretty damn handsome. Breathing problems probably going to get resolved by the MSE because they seem to be primarily nasal. Yeah, you considering double jaw surgery would be a little bit of a stretch. That being said, you are in the neighborhood of probably my favorite double jaw surgeon in the whole world, who's Mirco Rafaini in Italy. Do you know him?
I don't, but that's good news.
That would be the X factor for you. Like, you might do it just because it's available.
Mm-hmm.
And like just because Mirco Rafaini is that damn good, where his results are fucking incredible, and he's an aesthetic focused surgeon, meaning he creates art out of his patients.
Okay.
His cases, he doesn't even photograph them for 3 years, because he really lets the surgery mature and he lets the person grow into it before he says, okay, this is how it turned out. But yeah, you can check him out on Instagram. Mirco Rafaini, Mirco Rafaini. But apart from Mirco Rafaini, yeah, I wouldn't, see you as a obvious candidate for double jaw surgery, not by any means.
Yeah. No, I agree. I will see Mirco Rafaini and maybe do a consultation also if he does online, just to hear his opinion. But
We'll say one more thing about Mirco Rafaini and about Italy. There's also a MSE provider in Italy named Daniel Cantarella, and he works with Mirco Rafaini. They work together. They're not like a team. They're in different parts of the country, but they've had shared patients where Cantarella is the orthodontist, the MSE provider, and then Rafaini does the final blow with the Bimax.
okay.
Yeah, they're dope.
Okay, I will for sure check these guys out. Because here in Greece, we don't really have someone, not anyone doing MSE at all.
Right, I didn't know that, but
Yeah.
yeah, you'll have to go. You'll have to sail down the Mediterranean to your neighbor to the west.
Yeah, that's easy. Okay. So, should I start with some questions that I had that maybe you can help me with?
Please go ahead.
Okay. The first question was about the how many centimeters you think I should expand, but I think you answered it with around 5.
Ish, yeah, 5-ish.
Okay.
Plus or minus 2 millis.
Okay.
I would say, Stefanos, for you,
Yeah.
you should expand until your nasal breathing is significantly better. And then what you'll find is it plateaus, meaning that if you turn 4 times and you get an 80% improvement in your nasal breathing, turning 8 times, double, doesn't mean you're going to get 160%. It plateaus. So you have to find that sweet spot where you get enough expansion, your breathing is significantly better, and then at that point, it's all aesthetic. You have to decide, okay, am I going to look weird if I go anymore? Am I going to start to get balloon facey, da-da-da-da thing? So, like, yeah, focus on your nasal breathing since that's your primary issue.
Mm-hmm.
That could be fixed with 3 millimeters, bro.
Yeah.
Who knows?
Yeah.
Okay.
Okay,
Next question.
very, very interesting. I wanted to know how many successful MSCs have you seen, and how many MSCs that had a problem in the end, like asymmetry or something like that, approximately.
Good question, bro. Good question. Good question. MSE is a shit show, and I cannot dance around that fact.
Yeah.
Bad MSE cases are drawn to my channel and to me like flies, like moths are drawn to the light. Okay, I'm like Yelp for bad MSE cases. All of the shit comes to me because they want to talk to me about how it went wrong and what to do about it. So I've seen a lot of bad MSE cases, and you've seen a lot of bad MSE cases who've been on my show, right?
Yeah.
In terms of good MSE cases, I've seen a lot of those too. The MSE user group is full of good MSE cases. There's so many MSE providers on Instagram who show really good MSE cases. I'm thinking right now of that Turkish MSE provider. I'll drop a link in the description. She's great, and she's got a lot of really impressive MSE cases that she puts up on display. Even though it seems like there's more bad MSE cases than there are good ones, think of it like this. In the early days of the automobile, or take a more extreme example, in the early days of airplanes, it was all fucking crashes, right? The first probably 50 airplanes that were ever invented fucking crashed and burned, right? That's kind of where we're at with MSE. We're not in the early stage, but we're like still in, it's like the 1920s in terms of airplanes. We have really good airplanes, but a lot of them are still shit, and a lot of people are still flying them like shit. So, but the things that cause bad MSE cases, we're figuring it out quickly. For example, what causes a bad MSE case? Poor surgical assist, which causes the appliance to do too much work. Then the appliance gets skewed and it twists, and then it expands you in a twisted way, or it cuts through the bone. You don't even get split. That's all solved by the piezoelectric knife. People go in, they see the dentist, they leave the dentist office with a split. And now the MSE can just expand nice and even without having to break the bone. That's new. More and more people are going to start doing that soon, I hope. Another big thing is just placing the appliance properly. Now everyone has an appreciation for how important it is to get that appliance dead nuts centered in the patient's mouth. Otherwise, think about it. If you install it twisted, it's going to expand twisted. So the labs are getting better at making them, and more dentists are starting to rack up cases and learn from their mistakes. And so we're exiting that early period of bias toward bad cases, and I think we're going to hit a stride soon of decent MSE cases. But being dead ass with you though, there's a lot of fucking bad MSE cases, and if you don't have the right provider, fucking good luck, man, because I'd say there's a 50-50 shot it's going to go sideways.
Yeah. Okay.
Cantarella, though, in Italy has been doing MSE for a minute, though. He's been doing it for like 4 years.
No, I was very, very pleased to hear that someone close by. This was one of my questions to see if you knew anyone in Europe doing MSE. But having someone so close that you consider him being good is very good. Yeah. Other people that do MSE in Europe and that you have any comments on them?
So stay away from England. First of all, England is it's in a dark age. I feel like with orthodontics, with the prosecution of Mike Mew, and there were a couple of MSE providers in England, but patients have been reporting to me recently that they're being super conservative, meaning that if they're not expanding people for airway, like if a guy like you with nice teeth shows up and you're like, hey bro, I want MSE, can you hook me up? They'll be like, no, there's nothing wrong with your occlusion, like you're not a candidate for MSE. So stay away from England, they're too conservative. There is a guy in Germany, Dr. Moschik. And then honestly, bro, since you're in close to East Europe, I know you're sort of on the line, but let me this Turkish orthodontist. There she is. I found her. Aise Cemile. I'm gonna just screen share her page with you right now.
Yeah.
Because if you can make it out to Turkey, and it'll probably be super affordable out there too.
It's very easy to go either to Italy or Turkey for me.
Check out this is the Turkish orthodontist that I'm telling you about.
Yeah.
I don't know exactly how to say her name. Aise Cemile, I think. I think the C is pronounced J, Cemile. But bro, she gets it popping. Look at this guy.
You see the
Go ahead.
Yeah. If you go up a bit,
this guy? Oh yeah, she loves face mask, bro. She loves face mask.
Yeah.
She's all about MSE and face mask.
She did correct the forward.
The recession?
The recession, yeah.
Yes, but this was a class 3. Look. See how oh yeah, look, he had some kind of surgical assist. Look at that blood.
Yeah.
That's what you want, bro. You need that. That's gnarly. Oh, and look at the face mask hooks right there.
Yeah.
See it?
Yeah.
Boom. Wow, this whole tooth is capped with MSE anchorage. That's fucking never seen that before. But yeah, I see how he's a class 3.
Yeah.
You're not really like that, bro. See how his back teeth are touching and he's still upper teeth behind lower teeth? That's a real class 3.
Yeah.
I don't know what's going on with this dude's teeth though. See that? That's weird. But yeah, this is definitely sort of similar to what you're looking for.
Yeah.
Right.
Okay.
Unfortunately, I can't read this. It's in Turkish, but here's another one, maybe a face mask. His lower jaw definitely came forward. I don't know how. Something happened there. Look at that dude. Completely different.
Yeah.
That might be MSE and face mask too. Yeah, look, she split them. That's an MSE and face mask, another one.
Yeah, okay. I will take a look at her also.
Damn, look at that cortical puncture. That's gnarly. Okay, yeah, so check her out, okay?
Okay.
Let me stop the screen share. Hold on.
Okay. So the next question was, what were the problems that you see mostly occur with MSE, other than asymmetry?
Asymmetry, failure to split.
Okay. So
I mean,
both
people take that for granted, but a lot of people, they don't even split with MSE. That's a huge part of it, bro. Especially adult men like you.
So that's where to assist the split would be ideal, I think. Okay. About cheese wiring, which is also a common, I think, issue. For the
what was
MSE,
that? Can you say that again?
Yeah, it's the what they call cheese wiring, which is where the MSE expands without moving the bone.
Oh.
It expands
inside
the
that's
bone.
that's and are you saying that it then expands the teeth? It pushes on the teeth because it cuts through the bone? Well, I know I know what you're saying. You're talking about the screw drag. You're talking about when the screws cut through the bone without right, but sometimes when that happens, and I thought this is what you were saying, sometimes when that happens, if the MSE still has arms on it that are connected to the teeth, like remember I was just showing you Dr. Cemile and how she has the MSE connected to the teeth with those arms.
Yeah.
If the bone, if the MSE cuts through the bone, but it's still connected to the teeth, it fucking flares the teeth out like nuts. So that's a major problem. That's a super rookie mistake that happens by really new MSE providers. Very dangerous. Because they think they're getting expansion, but they're really just taking those molars for a ride with the MSE. It's like the most aggressive type of tooth-borne expander you can think of when it's cutting through the bone. But yes, the surgical assist helps prevent the bone drag, the screw drag through the bone. Another thing that's really common now is 6 screw MSE to get more anchorage in the bone. Because if you spread the force out, that takes less force off any one screw, and it makes it less likely that one screw is going to puncture the bone and cut through it.
It was my next question. Yeah.
Yes, there's also tandem MSEs, meaning you put 2 MSEs in instead of 1. Now you have 8 TADs. Some people do that too. There's all sorts of things you can do to reduce these problems of failure to split, and well, asymmetry is a little bit of a separate problem. That's more complex.
Yeah, so my next question was about devices with 6 or 8 screws, but you said also double MSE devices.
Yeah, they call it tandem.
Okay.
They call it tandem. If you ever see someone say tandem MSE, it means 2 MSEs.
Okay. And then last questions were about the mandible, and do you think in my case the mandible should what should I do with it to follow the expansion, or it will probably not be so noticeable?
Yeah, so let's just start with what you're not going to do, because it's just not going to be available to you. You're not going to get the DAME. You're not going to do MSDO, because who's going to do it for you? I don't know anyone out there that does it. Second question, do you need it? I don't think so, bro, because first of all, we're not talking about a huge amount of expansion for you. We're talking minimal, 5 milli, right? Second, your upper teeth are flared out right now. And if they have a lot of space to flare them back in, tip them back in, you can easily pick up 6-7 millimeters of skeletal expansion on the upper, and then just take those upper molars and tip them in, and then you get a bite back. So, but I don't even see you doing 7 millimeters. I see you doing 5, 6 of real expansion. So I think you can absolutely accommodate that amount of expansion with tooth-borne correction of the upper and lower. Dental matching of the upper and lower.
Yeah. Okay.
Let me make one comment now that it's occurring to me. Let me just look at your pictures before I make that comment. I don't really have a good frontal picture of you, but based on the grainy video, your cheekbones are prominent.
No.
Your cheekbone, they look it, man, from the video. They look more prominent than other parts of your face. So rather than us arguing about that, let's just assume that they are relatively prominent compared to the rest of your face. One other reason why you shouldn't go crazy with MSE expansion is because you would be the kind of guy who could become a balloon face. The balloon face is when your cheekbones get too wide as compared to your chin and your mandible.
Yeah.
So I could see that happening with you. So that's another reason why you should be careful when you expand with the MSE. You don't want to become a balloon face.
Yeah. Two comments on this one. One is that I see that my eyes don't have the support here on this here. They don't have the support from the cheekbone, so the cheekbone seems like it is a bit lower. That makes a lot of times the veins to show and stuff like that under the eye. And then my face is a bit heavy here, but it's, I think, not because of the cheekbones being out, but because of the lower part, the jawline not being very strong, because of the teeth not connecting right, and the jawline is like underdeveloped because of that. If my jaw was connecting with my teeth here, and I was doing this when I was chewing, I think this would be a lot more developed, and the face wouldn't get heavy in the mid section, if that makes any sense.
Yeah, that makes sense. That could be.
Yeah.
Fair enough.
But yeah, for sure, I will be checking with the MSE to see if anything starts not looking normal. And then last question was about osteopathic doctors or other doctors that could assist while doing MSE by looking at the bones or putting them in other places, let's say. I don't know if you have heard anything like that.
I did a video recently about osteopathy and whether it was legit or not. It's called Osteopathy, Legit or Cope. And basically, man, how I feel about osteopathy is it's a luxury that some people, if you can afford it, why not? Like, I don't know for sure whether osteopathy helps with skeletal expansion. Yeah. I know it probably doesn't hurt. I'm not saying go out and get crazy chiropractic adjustments and crack your neck and this and that, and get rolfed with a friggin' club. Osteopathy is very subtle. It's just a doctor putting his hands on you usually, right? And then prescribing you some herbal treatments and medicines. That's not going to hurt you. But for a lot of people, it's just the results are too non-transparent, which means when you leave the osteopath, you can't notice an immediate difference. You might feel better because it's like a massage, and there's that effect of having another human being put their healing hands on you, and that feels good, and you have a little bit of a high after that. But you're not going to actually see any physical difference in your body. So because it's such a non-transparent type of treatment, you sort of just have to trust that there's something positive happening in the background. It's not worth it for some people to spend $100, $200 for 30 minutes of that. Yeah. But if you have the dough, if you're a millionaire, or if you got $100,000 in the bank and you want to splurge on some treatment to help your MSE, I think it's definitely up there in terms of top supplementary treatments to MSE that I would consider if I had an infinite financial resources.
Okay.
Does that make sense?
Yeah, totally. This was.
But ultimately, bro, what's happening is you have a fucking piece of metal in your mouth that's splitting your skull, right? So that's going to be the dominant action in your bones during that period. Is osteopathy going to help it actually split you? No, it's not going to help it split you. Is it going to help in some other weird way to? I don't know. It's not going to soften the bones either. It's not going to assist really the expansion in any way. It could help the symptoms, maybe. I don't know. But yeah, I wouldn't count on any major benefit from osteopathy during MSE treatment. You sort of just have to grit your teeth and just let that fucking thing break you.
Yeah. Okay. These were my questions. I don't know if you you feel like you have anything else to tell me before I continue with that?
Yeah, I think you should get those patches in your beard filled in.
Yeah, I will.
You know, I think that just in terms of general looks maxing, if you can fill in this spot, here and here, I think you'll be a stud. You know, I think that first, I think you're a stud now. I think you're a very handsome guy. But yeah, those are just some obvious, very high yield looks maxing things that you can do for relatively low effort. I mean, you'll have to put some money into it, getting hair. There's all sorts of products that you can try. There's one called Rogaine that
I am using I am using Rogaine for a lot of years now. For my head and my beard. My beard wasn't even that thick before I was using Rogaine. I'm using Rogaine for at least 4 years now.
Wow.
Here it is scarce, so you cannot have nothing grows there. But with a hair transplant, I would feel these. And as you said, you are the first person that actually comments on that, other than me. These here, maybe not all the way, but here and here. So these two would help a lot on how my beard is looking. And so this was the plan for this year or maybe next year to go and fill these with a hair transplant. Yeah.
Good,
Yeah.
man. Good. Yeah, I support that plan.
Yeah.
And then in terms of other things, you know, man, just what else is going on in your life? Like, what do you do for a living and stuff? Are you happy?
Yeah, I'm very happy with what I'm doing right now. So for the past year and a half, I'm almost you could say the general manager of a real estate fund. So we buy apartments here in Athens, we renovate them, and we sell them again. And that goes very well for the past year, and it has a lot of in the future it has a lot of potential, let's say.
Good.
Yeah. So I am in a journey where I'm seeing stuff that could really help my life outside of working, like breathing better, and gym. For the past a year and a half, I've been going to the gym fully. Yeah, I'm trying to fix minimal stuff that can improve the general life quality.
Yeah. Besides your breathing and the gym, what do you think is the other big area in your life where you can improve?
You mean physically or in general?
Anything. Spiritual, physical, relationships, dating.
Dating life is not perfect right now, but it's not my goal in this stage. As I told you, I'm 24, and I don't see a lot of reasoning on pursuing dating a lot. I want to achieve some stuff before. Here and there, I might do something, but it's not my goal.
It's very wise, bro. It's very wise.
Thank you.
Keep building your career, getting your health together, and then, maybe in a couple of years you'll have your whole life put together, and then you can really get the woman you want.
Exactly. Other than health things, for the past year and a half, my life has been in some type of a schedule, let's say. after a lot of work for the previous years, because I had to do a lot of stuff to get to the career that I am now. But I think it now starts to have a result and something to how do you say it? Some potential, yeah.
Good for you, bro. Good for you.
Thanks.
Yeah, you really have your stuff together. I'm very impressed.
Thank you, man.
I guess one thing that came to mind is that you have this plan to do the face mask. I just want to remind you that the face mask is incredibly inconvenient. You know,
Yeah.
especially for a guy like you. I feel like you're a social guy. You seem really cool. I'm sure you go out. It's Europe. It's not like America where people don't go out. It's a very active social life in Greece, if I'm not mistaken, especially in the city. Just remember, with the face mask, you have to wear it a lot, bro, to get results. A lot.
Yeah.
So just to have your expectations straight on that. You got to wear it all night, and then any amount of time during the day you can wear it will be necessary. So I'm not sure that it's going to really suit your lifestyle. Maybe it is. Maybe you're willing to sacrifice for a year. I don't know, but just keep that in mind.
I think I am willing to try it at least, because wearing it all night is not a problem, and due to the nature of my work, my time is a bit flexible. I do have hours that I stay at home in the morning doing emails and stuff. I can wear it then, and then I have to go out. I can take it out and come back and wear it again. So I think I could do it because I don't have a 9 to 5 job where I couldn't wear it then. It might work, I think. Yeah.
Yeah, so you did understand what I said earlier when I said how happy I am to be self-employed, because you are too.
I'm not completely self-employed, but I have almost all the benefits of being self-employed because the people who I work with have given me some freedom to do stuff with my time as I think, as long as the work is being done. And also the payment is according to what I produce, which is also very important, I think. Yeah.
Good.
Yeah.
There was another thing I was gonna say. What was it? If the MSE doesn't fix your breathing problems, okay?
Yeah.
Then you have to do what they call a DISE. Have you heard of DISE?
No.
Drug-induced sleep endoscopy. So, do you have breathing troubles when you sleep too? Do you know?
I used to have a lot, but as I told you, for the past year, I don't wake up because I'm using nasal spray.
Right.
But I do feel very, very tired when waking up and not wanting to stop sleeping. But I was always feeling like that.
Okay. So what DISE is, it stands for Drug-Induced Sleep Endoscopy. It's a diagnostic procedure where you sit on the table and they give you a little bit of anesthesia to put you to sleep. And then they run the endoscope through your nose and through your whole airway to see where the blockage is. So this is a way of identifying, instead of us guessing where your blockage in your airway is, this is a way of concretely identifying this is exactly where the blockage is for this person. So I think the MSE is probably going to solve a lot of your problems, but if it doesn't, then you have to take the next step and consider doing a DISE. And then whatever the results of the DISE are, you have to let that inform whatever next steps you take to treat your breathing problems, okay?
Yeah. I could probably do it also the other way around. Do the DISE now, if I have it here in Athens somewhere, and see what is the problem from before. But yeah.
You could,
Yeah.
and you probably should.
Yeah,
The only reason I'm pretty confident that the MSE is going to help you is because the nasal spray helps you.
Yeah.
The nasal spray is just it's reducing inflammation in your nose, right? It's clearing up your nose. And if clearing up your nose helps you breathe better, then there's at least some significant blockage in the nose itself. And the MSE is great for that because it just widens the whole basal bone of the nose.
Yeah.
But yes, if I were you, another thing you can consider is doing a DISE immediately and maybe even doing a sleep study immediately, just to have it on record.
Yeah, yeah.
Because if you speak with the surgeon is going to want to see those results.
Yeah. 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 So I will probably try and do that. Yeah.
Cool.
Okay.
All right, bro.
Yeah. I'm good. I wanted
All right, bro.
to thank you a lot, Ron. I think what you do is very good. I don't have the best English to express, but I think what you're doing is very helpful for a lot of people, and it's very helpful for someone like me to be speaking with someone younger who has passion with what he's doing and can really help and guide. Yeah.
Thank you, bro. That means a lot. No, your English is excellent, and you do have you're extraordinarily articulate for someone who English is their second language, and you know I have a tremendous amount of respect for you, and I can tell just from talking to you that you have your life really well put together, and that when you're my age, 8 years from now, God, I can't believe you're 8 years younger than me. You're gonna be a fucking boss, man. So. You're already a Chad. You're going to be a Giga Chad and a fucking man. Never mind a Chad, a man. So, really enjoyed talking to you. And you reach out if there's anything more I can do to help you. Okay, Stefanos?
Thanks a lot, Ron. Thank you.
All right, bro. Take care, okay?
Yeah, yeah.
All right.
You too.